Through this video, I would like to allay some myths and misconceptions about cancer and cancer treatment. So, folks, we are in the information age, but honestly speaking, when it comes to medical science, we are in the misinformation age. There is so much of misinformation that is being spread around social media and various forums, wherein forget about patients getting the right advice. Many of them tend to follow the wrong advice, and those advices which should definitely not be followed by a cancer patient. So I thought I'll make this video on trying to clear a few myths and misconceptions about cancer. So the first thing, one of the biggest questions that patients ask: Doctor, I've got cancer and I have seen through some WhatsApp message that I should not have sugar. So I have avoided rice, I have avoided anything that has got sugar. So my answer to them is, there are two types of sugar: the sugar that is sweet and the sugar that is not sweet but then goes inside your body and still forms sugar. So for example, when you have rice or bread, these are carbohydrate sources. So when you eat them, they become sugar in your body. So it is not completely necessary to avoid all sugars, may it be sweet sugar or the unsweetened sugar. But what is important is that you should have the natural sugars. What are the natural sugars? Natural sugars are the fruit, the whole grains. These are natural sugars. What are the unnatural or the synthetic sugars? They are the chocolates, the ice creams, the white sugar added substances. It could just be a milkshake. All these are what I would call as the synthetic sugars. So yes, it is important to avoid synthetic sugars because consumption of large amount of synthetic sugars is known to increase certain hormones in our body, such as insulin and insulin derived growth factors, which are known to drive cancers, which are known to make the cancer more aggressive. So let us not completely stop carbohydrates, but make sure to stop the synthetic carbohydrates. So that is what I would like to summarize. The next myth and misconception I have heard is that usage of antiperspirants or the so-called deodorant sprays, hair dyes, they all cause cancer. It may be true to the antiperspirants and the hair dyes which were manufactured maybe 20 years ago, but today's good quality products do not contain these carcinogens or toxic chemicals which can cause cancer. So you can continue to use them because most of them contain constituents which are not known to harm the body and cause cancer. The third misconception, and this is a very big one, is allopathy or modern medicine is not the best therapy for cancer. Alternate forms such as homeopathy, Ayurvedic are the best treatments for cancer. Well, I would like to not compare the different sciences of medicine, but I can clearly convey to you that there is a lot of evidence based on publications and clinical researches that have been done which show that modern medicine is probably the most effective form of cure and control of cancer. Modern medicine is not just synthetic medicine. Many of the chemotherapy drugs that we use are actually extracted from natural sources. But all of them are studied in thousands of patients in double-blind settings so that the results are not biased and they are known to be effective even in clinical practice. I am not sure about how much evidence is there to the effect of the alternate forms of therapy on cancer. Another common understanding amongst people is that cancer treatment provided by modern medicine is extremely toxic. So I thought I will probably describe this misconception in detail so that all of you can understand the reality. So just like everything else in this world, even oncology or treatment of cancer has gone through various stages and has gone through several developments. It is true that the earliest cancer treatment medicines which were available in 1970s and 1980s would cause toxicity. This was partly due to two things. One is that there were no adjunct or supporting medications to avoid the side effects caused by these medications. And second is that these medications themselves were not as refined in those times, due to which they used to cause side effects. But today is not the case anymore. We have almost stopped using many of the medications that were used in those days. Many of the medicines that were unrefined those days are well refined now to reduce the side effects associated with many of those medications. We have naturally derived carriers of drugs, due to which the drug reactions that used to be caused by the chemicals added to the chemotherapy drugs have reduced drastically. Today we have personalized targeted therapy, wherein the receptors or the targets on the surface of the cell or the inside of the cell are basically known to us, by which we can use certain molecules which act only on these targets. So these are called as targeted therapies. You may have tablet forms of these or you may have injection forms of these, and they both help in controlling the cancer such that side effects are not encountered. Another thing is about people believing that there are going to be long-term side effects of cancer therapy. For example, when people lose hair during initial phases of chemotherapy, they believe that they are never going to get their hair back. In fact, it is uncommon and rare to not get your hair back after completion of cancer therapy. Many patients are scared about the vomiting that cancer therapy causes. We have drugs today which have reduced the incidence of vomiting due to cancer therapy by more than 99%. Rarely do we see today any patient vomiting profusely with our treatments that we are giving. Many patients believe that even after the completion of cancer therapy, they will continue to be abnormal. It is not the case. We have so many celebrities, so many distinguished cancer survivors who are talking and spreading the message about the fact that once cancer is conquered, you need not compromise on the quality of life. There are cancer survivors who are bearing children. There are cancer survivors who are even climbing Mount Everest. There are cancer survivors who are now in big positions in major companies. All of this would not have been possible if the effects of cancer therapy was irreversible. The next thing that I keep hearing is the fact that cancer treatment is very expensive. Well, I know that there is no price that can be attached to life, but let me tell you one thing. Cancer therapy in India is far cheaper than in the West or many developed countries. The government has subsidized many of the cancer treatment medications, surgeries and radiation therapies, so that even the common man can afford cancer treatment. However, I would also appeal to all of you to make sure that you take life insurance, health insurance, so that in the eventuality that any one of you develop cancer, your health insurance will be able to cover the expenses of cancer treatment.